going to have the great pleasure of introducing our keynote speaker here today, Dr. Brian Nosek. Many of you have, I'm sure, heard of Brian Nosek. He is very well known for the amount of work that he has done in really promoting the idea not only of reproducibility, but of open science more generally. He's the co-founder and executive director of the Center for Open Science, and he's also a professor at the University of Virginia in the psychology department. Many of you may know that the Center for Open Science has been one of the leaders in actually promoting a platform for registering studies, which has been something that's happened in medicine, but not in very many other disciplines in the past. It also provides a platform for archiving and sharing research materials and data. And really, the Center for Open Science, again, is just enabling open and reproducible research practices worldwide. Dr. Nosek received his PhD from Yale University in 2002, and afterwards he co-founded Project Implicit, which many of you may also have heard of. It's a multi-university collaboration for research and education that is investigating implicit cognition, so those thoughts and feelings that occur outside of awareness or control. Dr. Nosek investigates the gap between values and practices, such as when behavior is influenced by factors other than one's intentions and goals. And he has done many applications of this kind of research in implicit bias and decision-making. And a lot of that he's actually applied to the work around open science and reproducibility. In 2015, he was named one of Nature's top 10 and also named to the Chronicle for Higher Education Influence list. He has really been a huge influencer in the whole concept of open science and reproducibility, and we are very grateful that he is able to join us here today. And now I'll turn it over to him. Brian?
As Melissa said, my core research interest is in the gap between values and practices, what we think we should do, what we want to do, what we're trying to do, versus what we actually do in our everyday behavior. And while most of the basic interest that we have done in that is related to implicit bias, thoughts and feelings that might occur outside of awareness and control, and how they influence our everyday perception, judgment, and action with relationship to people based on age or gender or race or sexual orientation or otherwise, we also have thought about how we can apply that basic interest in bias outside of intention and awareness to how it is that scientists do their work on science, how it is we reason about evidence, how it is we promote an understanding of the findings that we have, and how we might end up unintentionally undermining the credibility of our own work by factors that influence us out of our awareness, and particularly given the cultural system in which we are embedded of how science is done, how science is rewarded, and how the norms and policies shape the behaviors that are ultimately introduced. So what I'd like to do today is give an overview of that work that we're doing through the Center for Open Science, which is really a practical application of that basic research interest. The gap between the values that we have for science, how we think science should operate, and how science actually operates. And I want to begin with a local example, because a lot of what we think about when we're considering how is it that we can cultivate research ethics in general, and then some of the particular practices, transparency, openness, reproducibility in particular, most of the action is local within our research subcommunities, local within our institutions, our departments, our laboratories. Because science is highly decentralized, and so there are many different actors that are shaping the influences over any one individual's behaviors. And one of the challenges that institutions face is how is it that we can facilitate people thinking about and enacting research ethics to improve the credibility, the quality, the integrity of the research that they do. And one of the mechanisms that's common in institutions is to provide ethics training through a virtual, online, scenario-based format, right? I get this yearly at UVA, others might get it at their institutions, where I need to go back through my ethics training review. And what I do is I log into a website and I read some scenarios or some policies from NIH policies or Department of Health and Human Services policies. And I have to answer some questions about, is this an ethical action, or what's the right thing to do under this scenario? And then I get my certificate of, now I've done my ethical work in order to make sure I have these principles in mind. Now, many have raised concerns that this kind of approach to trying to cultivate research ethics is abstract. It's distant from the issues that I face every day when I'm actually making decisions. I may not know how to translate those issues into practice when I'm confronted with situations that have ethical dimensions to them. And it just may feel like a bureaucratic burden. I got to go do this hour thing, and I just do it and check it off the list, rather than having it be part of how I think about my research. That really ethics and integrity is a fundamental core part of my everyday decision making. So one of the things that we did in partnership with Dina Plemons and Kevin Esterling at the UC Riverside was to conduct a randomized trial of a different way of thinking about approaching research ethics, distant from these scenario abstracted versions. And in this intervention, what we did was worked on developing an embedded approach, an approach to research ethics that was at the laboratory level and involved facilitated discussion among the lab members about particular issues that come up in research ethics and how it is we determine how we should maximize the integrity of the ethical practice of our work. This particular intervention was project-based. So a member of the laboratory identified a project that was ongoing in their lab, and then we organized a discussion among all of the lab members, PI and all of the members of the team, about two particular issues: how authorship is determined on projects, using this project as a specific concrete example, but then trying to develop principles for the lab in general, and data management practices for this particular project, and then abstracting for the lab in general. Also accompanying that discussion was training about how to use the Open Science Framework, OSF, a tool that can enact some of those practices so that the research team would have not just the conceptual ground, we can think about this in our project, but also how we can actually get it done. A key part of the intervention was that it had two sessions, and there was a facilitator that was external that helps to monitor and facilitate these conversations to be productive conversations, and a member of the lab who was not the PI who helped to lead the conversation. The idea being, can we elevate this discussion to something that everyone has ownership over, try to flatten the hierarchy that occurs a lot in research ethics considerations so that it can be an open group discussion in these labs. So it was a randomized trial. So 34 labs participated in the trial. They were randomly assigned to get this intervention or not. There were 184 members in total. And we measured outcomes at multiple stages. And the data I'm going to show you is from the 4 months after the intervention, what occurred. So one of the key things that we looked at was whether people reported that there was changes in their ethical views over the period of time. And what you're seeing here is values to the right of 0, positive values, are indications that people who were in the intervention group who participate in these discussions reported stronger feelings of that outcome compared to people that were in the control group. So there was an increased sense of changing ethics within the context of the laboratory. There was not very changes from whether people perceived that the lab had a data management plan. So it didn't introduce data management plans, at least in this sample. But it did show evidence, at least people perceiving that now the lab is more likely to have a clear authorship policy of how they determine authors. Then there were additional outcomes comparing the intervention and the control conditions. So for example, the intervention increase the sense that their ethics discourse, having conversation about ethics in the lab, is important and relevant to their work, increase the sense that the lab has ongoing respectful discussion about ethical related issues. It decreased the sense that there was lab disagreement about things in general, in particular for topics related to ethics, authorship, data management. And it increased the sense that people understood and had reasons for an authorship policy that the lab had, for a data management policy that the lab had, and commitment to preserving replication materials, using the OSF, for example, or other services like it for storing and archiving and sharing data. So while this is just an initial study, what the evidence suggests is that there are ways to cultivate an understanding and embracing of ethical practice by engaging researchers, particularly in the concrete issues that they face every day with the members where they have to make decisions about that ethical practice, and on topics where they can see the relevance for their work directly, rather than necessarily just abstracted from how they might think about these issues in general. Okay, so I wanted to give that as a specific concrete example within a local context, and spend the rest of the time now zooming out to how those things are affected by the broader cultural context that science creates and maintains that may interfere with research integrity, credible research, reproducibility. Because every individual researcher is themselves embedded in a system of influences from the institution that they're a member of and the various subcomponents of that institution, to the journals that they publish in, to the societies that they're members of, and to the funders that fund their work. All of these play a role in shaping the systems of rewards, the norms, the policies that face researchers, and how it is they decide about how to do their work. And one of the challenges that has emerged over the last many years and is now much broader discussion in science is how the values that end up being idealized for how science should operate are not necessarily what are instantiated in the systems of reward and requirement from these various systems. Now, there are lots of ways to talk about how it is we can think about what are the values of science. I particularly like to use Mertons Norms. Robert Merton, the sociologist of science, developed these 1940s and 50s of how he thought science is characterized compared to other ways of knowing things about the world. And he identified 4 key norms for what makes science unique. One is communality, the open sharing of information. Scientific claims don't become credible because I say, this is what I found, just trust me. They become credible based on you being able to evaluate the methodology that I used, the data that I generated, the inference process that I applied to that data to come to the conclusions that I say now are the claims that I make from this evidence, as opposed to the counter norm. No, just trust me. It's all secret, but you can trust me. Second norm of universalism. Research is evaluated based on its own merit. You look at that methodology to decide whether it's credible methodology, rather than particularism. Oh, she's famous. She must know what she's talking about, so we should trust it. Third norm is disinterestedness. Researchers are motivated by knowledge and discovery, just trying to figure out how it all works, versus self-interestedness. Really, what I'm here for is to get all the grants and all the papers and get the jobs and get advances in my career to get ahead of everyone around me. And then organized skepticism. Researchers consider all new evidence, even against their prior work, versus organized dogmatism. Right? I spend my time defending my findings, my claims, my theories against attackers out there. And while it wasn't one of Merton's norms, there is a common discussion of the norm of quality versus the norm of quantity. Now, these might be familiar or at least recognizable as ways that people have talked about the ideals of what science ought to be, or how it should be, or how it might be. But an obvious question is whether researchers themselves endorse these norms. And that's what Anderson and her colleagues did, is they asked, which of these do you endorse, the norm or the counter norm, and how you think science should be? What you're seeing here is the cumulative plot of their responses across norms, where in gray is the proportion of researchers that said that they endorse the norms over the counter norms on average. You can see that 90% of early and mid-career researchers endorse the norms over the counter norms. Whereas in black are those that say, no, I think science should operate based on the counter norms over the norms, right? A tiny percent, 2 or 3%. And then the gray hatches are those that said, oh, well, both of these have about equal weight in how I think science should be. So then they ask, okay, don't tell me what you think it should be like. Tell me how you behave in your work. And this is the responses. So still about 60% or more of people are saying I behave according to the norms of science over the counter norms. But an increasing proportion of the sample is saying that those counter norms also have weight, perhaps equivalent weight on my behavior. And still very few are saying I behave according to the counter norms over the norms. So then they said, okay, that's fine. That's what you do. Tell me what the other people in your field, what do they do? And it looks like this. This is the cultural problem in science. Almost everyone endorses these core values of how they think science should operate. They largely say that they themselves try to live up to them, but recognize some pressures. And they don't perceive that the culture around them, the same people that said they all endorse it, but the culture around them does not behave according to those norms. In fact, they behave according to counter norms more so that are about self-interested behaviors rather than things that are good for science. So when researchers, particularly early career researchers, are trying to make a go of a scientific career and they enter an environment where the values that they have are not what they see as embraced by the culture, there are difficult decisions that one has to make. I could stay true to my values, recognize that the culture doesn't reinforce them, and then as a consequence, perceive that what I'm doing then is disadvantaging my chances of having a career in science. Or I could say, well, I really want to have this job or this career, so I need to give up on my values and do what it takes to stay in the research culture. That is not a decision that we should want for any individual researcher, right? A dysfunctional culture is defined in part by the gap we see between the values of the members of the culture and what the culture actually reinforces in everyday behavior. So if the culture movement to improve research integrity, research credibility, research transparency is working, what we will see is convergence of these, that the values that we have, the hopes that we have for how science should operate are embodied in how we perceive and how it actually operates in daily practice. So there are lots of things that we can talk about what is in this gap. And there are many discussions that we'll have at this conference over the next 2 days about different factors that are interfering with credibility, with meeting our values, with reproducibility, and the consequences of the lack of values. For us, it comes down to a core issue, which is the incentives for my success are focused on me getting it published, not on me getting it right. I want to get it right. I got into science because I like trying to figure things out, pursuing the truth, trying to understand the problems that I'm interested in. But that's not the direct system of reward, right? What I'm rewarded for is producing results that are publishable. And some kinds of results are more publishable than others, right? I'm more likely to get published with a novel result than repeating a result that someone else had claimed previously. I'm more likely to get published for a positive result, finding a relationship between these variables or success of this intervention, than a negative result. There isn't a relationship here. This thing didn't work. I'm more likely to get published if my evidence is neat and tidy and all fits together, as opposed to evidence that has exceptions and things that don't quite fit and things that we don't quite understand yet or aren't aligned with my conceptual understanding of the phenomenon. So a novel, positive, tidy story is the best kind of story in science because it is the best kind of thing. You discover something new. It actually is effective and clarifies some understanding about something in the world. And all of your evidence supports that clean and tidy interpretation. That's an amazing accomplishment in science. But we know that that doesn't happen very often, right? What happens in research and in the lab is messy. It's halting. It's lots of false starts. It's things that don't fit together and don't make sense. It's an emergent understanding over many years for the problems that we're investigating, where we get a handle on those exceptions, the things that don't quite fit, before we get to more abstracted, clean understanding of how that particular phenomenon works. The challenge then, of course, is that the reward system is at the level of individual papers. And this cleanliness and hope for major advancements every time is not aligned with how it is we are rewarded for the work that we do. And so because we have lots of discretion in how it is we do our research, what we report from our research, how it is we present that research, we introduce the possibility of our reasoning biases helping us to rationalize behaviors that actually undermine the credibility while improving publishability of findings. So I might rationalize to myself, of the 10 experiments that I ran, the 2 that showed the phenomenon in the way that I anticipated are the ones to put in the paper. And the 8 that didn't were screwed up methodologies that I should never have done in the first place. I might, when I look at a variety of different ways of analyzing the data, the one that looks best for publication might be the one that I start to rationalize as the right way to analyze the data. Of course, we should exclude those items. Those are outliers, are not really showing the phenomenon the right way, but because of reasons that allow me to exclude them. Right? So we have enormous flexibility in how it is we do our work, which is great. We need flexibility to push into the unknown. But when that flexibility is not known to you of how it is I got to those claims, I might be unintentionally exploiting that flexibility for promoting research that is less credible than it ought to be, than it really is. And so that is perceived as one of the core challenges for why it is we might see less reproducibility and less credibility in the published literature than it deserves, than it seems. It's a lack of insight, of understanding of how it is we actually got to that evidence itself. There are many different solutions we could talk about improving the research culture. I want to focus on the 3 that we spend the most of our time on, which is transparency and sharing of the data and the materials, methodologies, protocols behind the work that is done, and pre-registration, clear commitments of what studies were done so that you can know if I did those 10 and I only reported the 2, you can at least see the other 8 and know that I left them out and decide whether you believe my rationale for not reporting them in the same way. And pre-registration for distinguishing clearly between plans in advance and unplanned discoveries, exploratory work done after. The distinction between confirmatory or planned work versus exploratory and discovery work is very important, because mixing up one as the other can lead to a false sense of confidence in particular claims. We really need both types of research. We just really need to know which one is which when it happens. So these are the 3 areas that we have been trying to work on. How is it that we can cultivate better understanding of transparency and sharing and clarity on pre-registration of what plans were in advance or not across the research community? And what has been very gratifying over the last 10 years is how many different actors in different parts of the research landscape have been pushing the same direction. This is really a culture movement that is largely driven by grassroots efforts of different individuals, different labs, different teams, different consortia that have pulled together to promote these practices. And that has helped to enable the stakeholder groups, the top-down influencers, the societies, funders, publishers, and otherwise, to start to change their incentives and policies and practices to align with the grassroots work that's being done by so many in the room today and everywhere else. So to give you a brief sense of how we conceive of a theory of change for culture change on these dimensions, I just want to give the digest version of how it is we approach this. We really think about our theory of change in relation with this pyramid in the middle. And it's not a pyramid indicating that the ones at the top have to happen after the ones at the bottom. It's reporting a contingency. The success of changes in policies and incentives are contingent on successful implementations of things lower in the pyramid. So the basic idea is that if you want people to do a new behavior, to promote behavior change that's ultimately embraced as a culture change, you first obviously have to make it possible. You need the tools and infrastructure so that people can do the behavior. If you want people to be more likely to do that behavior, you have to make it easy. You have to integrate into their workflows how it is they themselves do their work. And science is very idiosyncratic, right? Labs and individuals have their own ways of doing their work, their own tools and services that they use. And if you try to impose a whole new set of tools and services that's separate from their workflows, that's a really good way to ensure that they won't do it, because they're busy and they've got a way of doing their work. And so you have to try to work with the tools and services, the approach, and support the work that they do, rather than add on, append to their already full workloads and plates. Just providing effective tools and services isn't sufficient. You also need to work on the social elements of that change, right? Communities, we are influenced by those around us in how it is that science gets done. This is how we do it in our department or in our lab. This is how my subfield does their work. This is how we report it. These are the kinds of things that are the normal things to do that distinguish credible, legitimate science from incredible, less legitimate science. And of course, those communities are influenced by what are the actual reward systems. I might say, well, others do this, but no one's getting rewarded for it. Why should I do it? And so the incentives and then ultimately the policies are what make the behaviors get instantiated in the system, are really central to the systemic issues that can't just be solved by bottom-up efforts. All of these correspond to what might be a familiar normal curve that's rotated 90 degrees on the left, which is the classic diffusion of innovations concept from Rogers in the 1950s that's been updated over time, about how new technologies or new behaviors are adopted in communities, right? This is the origin of the term early adopters. And the core idea of this adoption model is that people have, at different stages of adoption, adopt new behaviors or new technologies because of different motivations. The innovators, those first adopters, are people who see the potential vision of that new behavior, are excited about the behavior because they're excited about trying new behaviors, or they see particular promise in that specific behavior. So they don't really care about what others are doing. They themselves are pushing the boundaries in order to see what's possible. And just providing infrastructure to do new behavior can be sufficient for innovators to start doing it, right? The more that it's easy and integrated in researchers' workflows is part of how they can do their work, the more likely you are to be able to get early adopters, right? Early adopters, again, motivated by the vision for what is possible with that work. They see its value for how it is they can do their work better, and they don't care as much about the external rewards. Making early adopter behavior visible, showing that here are researchers that are sharing their data, that are pre-registering their research, that are recording their protocols, is the basis for starting to shift the norms to get into the mainstream, the early majority. Right? The more that I see other people starting to do these behaviors, if it's visible, the more likely I am to say, oh, maybe this is a thing that we do now. Maybe I should do it too. And the great thing about normative interventions is the more visibility there is, the more likely individuals are to start doing the behavior, which increases the visibility further, which makes it even more likely that the next group of people will start to adopt the behavior. Of course, the norms itself aren't sufficient. That late majority gets pulled along if those norms get aligned with the incentives, how people are rewarded for those behaviors. And then, of course, there's always the laggards that don't want to change how they've been doing things for the last 50 years. And the only way to get them to change is say, well, if you want the paper, the publication, or if you want the money, you got to do it. And they say, I don't want to do it. Well, if you want the paper, you want the money, you got to do it. Fine, I'll do it. So these things are interactive and working together, and they're all necessary for effective full change of a research culture on individual behaviors. And you can translate this model to be global about the entire research culture, or think about it local. How is it that we can cultivate each of these things within the community that is our institution, our department, our lab, or our sub-community of research? So I want to give a couple of examples of just how we are attacking this at each of the levels, and I'll be delighted in discussion to hear more about how others are doing the same, because there's so many important actors in this space that are addressing one or multiple parts of this themselves, and in collection are really the drivers of the culture change movement. At the base, that infrastructure and user experience for us is organized around the Open Science Framework, osf.io. Free service for collaborative management, for private work, for your labs to manage your data, your materials, register your work, manage your IRBs, IACooks, whatever kind of content you need to organize those projects and manage it for collaborative teams. It tries to solve that problem for you, reduce the burden of losing stuff for your own work, and then make it trivial to make it more open. You want to share the data, you just click the button saying make it public, and it says, are you sure? And you say yes, and then it's public. So if we can integrate the private workflows that we have for lab management with public workflows for making that accessible to others, we lower the barriers to adopting open behaviors, and we provide solutions that help researchers in the workflows that they have, the things that they need already. So I won't say more about the technology, though that's what we spend most of our time on trying to pursue. And just note that it is a basis for supporting the other kinds of interventions that we pursue in trying to facilitate culture change. I want to move then to the norms, the communities level, because this is where that social engagement, particularly where individual actors collectively end up having substantial impact, really comes into focus. As I mentioned earlier, early adopters, if you can make their behavior visible, it can help to facilitate a change in norms, particularly when those norms are already things that people value. They just don't see the culture value in it, right? This isn't trying to change people's minds about whether transparency is a good thing. We know that earlier survey from Anderson and her colleagues, we know people value that. They just don't do it because they don't see that there is value in the culture for doing it. So visibility creates an opportunity. People are doing it. There must be ways to do it. Maybe it's not so hard to do it. If we can give evidence that it is occurring and that it is possible to do, then we may lower the barrier for norms to start shifting and for other people to start doing it. So signaling is the key intervention here, and badges provide an opportunity for signals. So the intervention here is the simplest idea of how is it that we can start to shift norms, which is create badges for when people do these behaviors, make data available, make materials available, pre-register their work. And then journals can offer these badges. And then once you have your paper accepted, then the journal says, your paper is in. If you would like to get one or more of these badges, if you can do the behaviors or you did them previously, then we will put the badge on the paper and then provide a link to the data or the materials or whatever. So as an incentive for me as the author, that's pretty small, right? It's not a big incentive for me to get a badge on the paper, but I might care about it, particularly as an early adopter, particularly because it's something that I wanted to do. I just have no acknowledgement for doing it. Where the likely bigger impact of such an intervention is on you as the perceiver. Here's a paper that has open data. Wait, there's another one. People are starting to do this in my field, right? It's that normative intervention of the signaling function. So we worked with the journal Psychological Science as the first journal to adopt badges in January 1st, 2014. And what I'm showing you here is the proportion of articles on the y-axis that reported having data available in Psych Science in black and 4 comparison journals in gray. In the 2 years prior to introducing badges, so 2012 through 2013. Badges were introduced January 1st, 2014, and this is what happens to the curves. So no change in the comparison journals, and Psychological Science within 18 months had 39% of the articles reported having open data. That's first half of 2015. If you look this year, it's over 80% of articles in this journal have open data, as indicated by the open data badge, and in very high numbers of the other badges as well. And it's the silly little badge, right? But of course, it's not the badge that matters. It's the behavior that it signals and the value behind that behavior that already exists, and the cumulative recognition that others in this sub-community are starting to do that behavior too. So there are ways to start to leverage values when they pre-exist and facilitate behavior adoption if you can make those behaviors easier and visible to others in those communities. Okay, that's one example. The other example I want to spend the time on before we stop for whatever time we'll have for discussion is registered reports. This is the cartoon of how science gets done, right? You design a study, you collect, analyze the data, you write the report, and then you publish it. But of course, it's not that easy. There's that big barrier of peer review that's after the report, before the publication. So the peer reviewers are the impediment for me getting the reward that I need, that paper. Registered reports does not try to upend the paper as the key incentive. It says, okay, that's going to be a hard thing to get rid of. Papers are the mechanism of scholarly communication. There is some degree that those will continue to be part of how researchers are evaluated. And there's lots of opportunities to diversify that. But for the near term, at least, we know that that is going to be a basis of evaluation. But what we can do maybe is shift how researchers get those papers. And if we can shift it to be values aligned, then we may be able to cultivate those values and credibility in the process of doing research, in the process of getting published, so that the papers are promoting values relevant outcomes. So the key intervention in registered reports is to move the initial peer review from after the report is done to after the design phase is done. So as an author, what I do to submit a registered report is I prepare my introduction that is the background motivating my research question or idea, maybe some preliminary experiments showing viability of the methodology that I intend to pursue, and then a proposed experiment or set of experiments that will test the concepts, the questions that I've developed in that. Then what reviewers evaluate is the question that I'm asking important? Is the methodology I'm using viable? And will it provide a meaningful outcome, good test of whether what direction we should think about that question given the evidence. So if it passes that, then the journal gives in principle acceptance. Here's the design you're committing to doing. It's now registered, what you're proposing to do, and what you will report as your primary outcomes. If you follow through with that, as you said you would do, we will publish it regardless of outcome. Then I go do my research, I write up the report, and I resubmit it to the journal. And the journal has a second stage of peer review that isn't about, are the outcomes what they expected, or are they exciting, or are they all aligned? That the second stage of review is, did they do what they said they were going to do? And did they interpret the results responsibly? Right? Is the interpretation aligned with what the evidence suggests? And if it is, the paper is published. This tweak to publication review dramatically changes the incentives for me as an author. In the traditional approach, everything is about the outcomes, right? The report is done, the research is finished. And so I need to write it in a way that will make it through peer review. And I know as an author that to make it through peer review, the outcomes have to be interesting, exciting, innovative, because that's what is often the focus of review at that stage. All the incentives are make it as novel, as positive, as beautiful as possible, both for me and for the editors and reviewers. In registered reports, I don't know what the results are going to be, neither do the reviewers. So my incentives are about ask the most important questions that I can and design the most rigorous, highest quality methodologies I can to test those questions. And that gets me the reward. And then everything else is just the results of the work. So the incentive system changes fundamentally. And then the obvious question is, well, what happens when journals do this? What happens in the research that is produced? Does it address things like publication bias, the systematic ignoring of negative results? Does it create a lot of negative results in literature? Does that change how people think about and cite that work? Does it change the actual rigor of the work? Well, there are now more than 260 journals that offer registered reports as an option for publishing across many different disciplines, with most of them being in social behavioral science and neuroscience, but expanding more and more, and a few very general journals that will